Hello, the audience. Welcome on our March edition of Startup Grind London. Today we have quite a few nice surprises for you. For the first part of today's event, we're going to be talking about how can startups get the maximum value out of working with corporates, especially how to get big corporates to make a contract with you and to start working with you. Please join me in welcoming the moderator of the first session, Peter Savik. Peter is a co-director of Startup Grind, and Peter will be moderating the first session about startups and working with corporates. Peter?
Well, hello, Marian, and thank you for your kind intro. It's really an honor to moderate this panel tonight. We're going to try to solve a corporate innovation puzzle and to kind of try to demystify the link between the corporates and the startups. And we have two very impactful corporates tonight. We have Vyra, which is a Telefónica's innovation accelerator, and a GE Healthcare, which is a health giant with their new Edison accelerator program. So since we only have 20 minutes to go, I would like to invite to the stage a Forbes 30 under 30, ex-Seeders, and now a head of venture development and partnership at Vyra, the brilliant and beautiful Patricia Nicole.
Welcome. Thank you, Peter. What an introduction. I wasn't expecting that, but thank you. It's great to be here.
No, it's really an honor. I believe we met at one of our Startup Grind conferences back in the day when you were just starting your career, and I'm very pleased to see that you progress so much.
Honestly, it was the first startup event that I went to, and I'm really happy to actually be on a panel with Startup Grind now.
No, it's absolute pleasure. And while we are waiting for Jan to join us back, we have another speaker from GE Healthcare, and Jan is a senior director and digital ecosystem at GE Healthcare, and he's also a lead for Edison Accelerator for Europe region. So while we are waiting for him, I wanted to ask you a question. Which is about why do actually corporates collaborate in startups in the first place, and especially when it comes to bringing the value, to your customers. And as we know, the Telefonica is a giant in telco space. And how do you work with these partnerships?
No, absolutely. And I have to say, no one company actually has monopoly over knowledge. We tend to say that corporates have to work with startups, VCs, their clients, universities to be able to launch really useful products and services. I think also when it comes to collaboration with startups, with corporates, you have your big product lines, your business line, right? Your cash cow that you're focusing on. And then you also want to have a lot of different products and services of value add to your customers. So at Telefonica, for example, we want to make sure that we're solving a lot of pain points for our customers, and then we can support them in a lot of different ways, not in just our main like comms, for example, or mobile services. So it's all about making sure that we exceed customer expectations when it comes to the service that they expect from us.
Amazing. Thank you for sharing that. We have Jan back with us. Hello, Jan. Great to have you here.
Hey, sorry, everyone. I mean, the event started and then my line dropped. I had to dial in again. Sorry for that. Look, from a healthcare standpoint, when I think about corporate collaboration with startups, I have to zoom out a bit and just explain the context for a second. When I think about healthcare, right, also comparing to other industries, we are behind in the digital transformation. Reason being that it's a complex industry which is closely regulated, and this is good, right? Because healthcare is a people business. It's a human touch business, and we impact the life of people, and therefore regulation is important, and it helps to ensure we implement and adopt validated technologies. And I think few other industries are as complex, comprehensive, and also fascinating as healthcare. It's, I think, now a year and a couple of days ago, I think it was March 13th last year, when the number of new cases became greater than those in China, and the WHO, the World Health Organization, began to consider Europe being the active center of the COVID-19 pandemic. And the global health crisis has put healthcare systems the last couple of months under immense pressure and exposed them to, let's say, the most gapping problems. And it has also demonstrated the critical need to reimagine how healthcare is delivered and really accelerated the pace of change. And despite the fact that healthcare is a high interest industry for AI investment, AI products in the space require more careful design and testing, I think, than those in other industries. And companies innovating with AI in healthcare need to really be prepared to invest time and effort and also expertise to create products that focus on the needs of healthcare providers and patients. And look, there are so many things to do in this space. And healthcare AI is such an exciting field where you can really have an impact and a serious impact to the life of millions of people. And there is no one company who can solve alone today's challenging problems. And there is really no way that one player can quietly address healthcare's complex problems on its own.
Yeah, and I mean, what I also wanted to add is I think what startups are really good at unbundling markets, right? So they create really highly customized niches that they can actually solve, and they have superior products than the incumbents. And I think that's a really great reason why corporates and should collaborate with startups as well. They can see pain points in an industry.
Yeah, absolutely. Look, and from a corporate standpoint, I think innovation needs to be far more dynamic and nimble and collaborative than in the past. And I think the future of innovation in healthcare will be really about working across silos and collaborating across the healthcare ecosystem. And this is including startups, including research centers, academia, big tech, hospitals, and clinicians. And we at GE Healthcare strongly believe in the power of a collaborative ecosystem to foster open innovation and the digital transformation of healthcare. And look, I mean, and from a corporate standpoint, GE Healthcare is a great global medtech powerhouse with very talented and passionate researchers, engineers, data scientists, and developers. But I mean, the smartest people are working outside, and we want to really join forces to build healthcare technology solutions together to make an impact and address relevant and really pressing problems in healthcare.
Yeah, I
Very
think
good point. Yeah, please go on.
Yeah, I think just a really good example is financial services industry, right? You can see that there were so many pain points in terms of how services would deliver to the end customers. And you just have fintechs that are using technology to solve those pain points. And now we're just expecting the same services and the same speed of service in every industry. And I think, for example, healthcare can learn a lot from fintech and financial services and how fast we can serve these customers. And, you know, I was on a panel with GE Healthcare last week about patient centricity, right? And how do we make sure that we implement the digital solutions needed to be really fast and make sure that our customers are served really fast in the healthcare industry. And it's a lot of the times it's just making sure that you collaborate with startups and other corporates in the space.
Absolutely, you know, and I would like to just echo that and believe healthcare is a bit behind other industries when it comes to innovation. But, you know, blessing and a curse being in the pandemic, we are all kind of driven by innovation is thriving really. And I see that cross-pollination where academia, corporate startups are joining forces to do this. And, you know, Nesta recently published another research where they found more than 500 open innovation sellers and needs. So many of them, really. And I wanted to touch base and ask you about those special open innovation programs that you have, both in Moira and GE Healthcare. Maybe if we could start with you, Patricia, tell us what different initiatives you run, you know, how startups can engage with that, with those programs, and just kind of what about strategic pathways for startups. startups?
Of course. And I think, first of all, for startups, you just need to make sure you choose the right path to working with a corporate that works for your stage. So, for example, if you're a very early stage company, you would go for a program that gives you a little bit of investment as well. If you're a later stage company, you probably look to a corporate just as a sales, as a partner, right? To make sure that you go to market together. At Wayra, we collaborate with startups in a couple of ways. I think, first of all, we have innovation scouting. So we work with our business units. We try to understand what their challenges are, and then we look for solutions globally. We then come and bring the team in to pitch to our business units. And if there's a fit between the startup and the business units, we can actually invest and we can start working with them. And I think what's really important is, for startups, when you are working with corporates or corporates approach you to see if you can work together, just make sure it's not just the innovation department. Make sure you have the business unit that would buy your solution involved. Make sure you have a technical team that understands the integration between the two solutions. And of course, the team that can be your champion internally, and ensure that you onboard successfully into the corporate. But make sure you have this ecosystem within the corporate as well that is working with you, not just an innovation department. I think a lot of our startups say that you go and die in the innovation department. You need to make sure that you work with everyone in a company and there's buy-in from all the teams.
Great actually potential thing for startups to get acquired or in acqui-hire or whatever stage they're at. But Jan, can you tell us about Edison platform and how you engage with startups and scale-ups in different stages, maybe?
Oh, absolutely. Look, and to add what Patricia just said, depending on the stage you're in, you should choose a program that like fits your needs and what you're looking for as next steps. I mean, from a G Healthcare standpoint, we are running different open innovation programs or collaboration programs. One is what we call the Edison Developer Program. This is a global program which is designed for, let's say, market-ready companies, focusing on integration, so innovation integration, on the deployment, and then on the commercialization. And then in addition to this, in different parts across the world, we run like regional accelerators to partner and engage with early stage up to like close to market ready ISVs to address the relevant and pressing problems in healthcare together. And look, let me talk a little bit about this because I think that's pretty important when I say like pressing problems and so on. So what we see a lot is that the startups in healthcare, and especially in the healthcare AI space, they are lacking a couple of fundamental things. One is often access to healthcare professionals, access to healthcare expertise, to know-how, clinical mentoring. They often lack access to even validated problem statements, access to healthcare data, and of course also a chance to run like pilots and proof of concepts. And what I've seen over the last couple of years is that, right, and some people would debate with me, but traditional corporate accelerators, they do not work in healthcare. And when I say this, I mean, you have the big corporate coming up with some fancy ideas. They try to find some innovative startups to work together to solve this. That's not working in healthcare. What we need to do in healthcare is we need to get healthcare provider institutions involved. And this is what we do with our program.
So you basically help them with the regulatory pathways and then many other things like access to health data, I guess, expertise, and risk. And could you maybe tell us about those main challenges? What are the main challenges when you onboard a startup and work, especially in AI and health? What do you think is the main challenges are?
I mean, look, there are a variety of different challenges. What we see, and I give maybe a specific example, right? I don't want to tap on the toes of anyone, but there are a lot of companies in healthcare AI today that build solutions or AI apps for, right, on the imaging side of things, for lung nodule detection, right? This is great. This makes sense, right, to build improved algorithms. But the question is, what is the, let's say, benefit for a company to work on a space that's already packed? Yeah. So what I was saying is one of the things we provide in our program is validated problems. So what we have done when we designed the Edison Accelerator was to get in touch with large healthcare provider institutions across Europe. We sat down together with them, spent like hours in innovation workshops to figure out what of the variety of different problems in day-to-day healthcare delivery we could tackle and make an impact on with digital technology and AI. Yeah. So this is one validated problem statement. The second is when you want to build AI solutions, you need access to data. You need access to quality data that's labeled or annotated and that you can use to build your models. And this is what we also get through the healthcare provider partners that are part of this program. Yeah, and then you can tap into their know-how, into their expertise, into clinicians, nurses, radiologists, and leverage them to make sure your product development is like steered and focused, and you get to the solution really.
Absolutely amazing. Patricia, can you tell us more about Beyond Health? What's happening in Vira when it comes to fast procurements, and then you kind of how you set the KPIs for tracking success?
Absolutely. And I think just to echo what Jan was saying, I think getting the customer involved in the feedback loop with an innovation is missing a little bit. So what we're trying to do now, for example, if we're working with a business unit and they have a certain challenge, we're bringing some solutions or some startups. We're trying to actually work with the account manager and get some of the customers involved as well to get their feedback, because sometimes we decide what the clients want on their behalf, but actually it would be much better if we would include them. I think challenges working with startups, and just a couple of things that I want to tell to the startups in the audience is, with corporates is you have very long payment terms or a very long procurement process and onboarding. And what we're trying to do now is make sure that we onboard. You have to have the infrastructure to work with startups before you actually work with startups. So at Wayra, we make sure that we have a faster onboarding process and faster payment terms. So if you work with the startups, you can't pay them in 90 to 120 days. You need to be able to shorten that time. So there's platforms like AppDirect or CloudBlue, which we use, and just to make sure that you are working with these startups and you're paying them a little bit faster. Another thing I think we've realized when we're working with software startups is that they want to use the enterprise as a channel partner, but they don't want to sacrifice any of their margin. But you have to think about the enterprise, all of the different layers of margin that they're sacrificing as well to onboard a startup. So you have to have kind of the sales team, CapEx to onboard. You need to train your sales team, and we have these startups that are really holding on to their margin, but they have to think about an enterprise as a channel partner, as a market share. So you're getting a lot of market share if you're working with an enterprise. You can triple, for example, your revenue or the number of customers you reach out to just because you use them. So I think just making sure that you're not too worried about your margin and you sacrifice a margin, profit margin for market share. I think that's one of the other things that we find challenging working with startups. And another thing that I would definitely mention is partnerships between corporates and startups take a lot of time. So don't put your eggs in one basket. So don't think just because the conversation is going really well with an enterprise, that's going to be your main focus. I think it's always good to make sure you diversify your focus. We've seen that because budgets can change really quickly in a corporate. Your people change very quickly, so you can lose your internal sponsors very quickly. So I just want to make sure that startups manage expectations and they use this opportunity to work with a startup in the long term. It doesn't happen very quickly. It takes us a while to get things done, even though we work with a lot of startups.
I think that was an amazing advice for the startups in the audience. And then finally, we just wanted to invite startups to join your new collaboration between GE Healthcare and Vira. And can you tell us a bit more about the application and kind of the challenges you have, and maybe Jan can cover some of the 3 tracks in short before we move to our next speaker?
Yes, sure. I mean, let me start maybe with the tracks and talk a little bit about content-wise. But what you always can do is go to the Wayra UK website. You can see our, let's say, innovation challenges described there. And if you have questions, just reach out. But what it is, basically, we are working in our first cohort that starts very soon, right? The scouting ends on the 5th of April. We are working on 3 different areas in the healthcare AI space. Number 1 is really on the imaging side of things, right? Radiology imaging, oncology imaging, cardiology imaging. And what we want to do here is we want to make sure to get to the, let's say, expected results of AI adoption in healthcare, which is to get to more efficiency, productivity, to more quality, and ultimately to better patient outcomes. And this can only be achieved when we integrate those novel but very niche AI algorithms that are coming into day-to-day clinical use, when we integrate them as seamless as possible into existing digital healthcare workflows. And this is what we want to tackle in our what we call track 1. Track second use case is circling around predictive analytics. Here we want to add a couple of predictive analytics tools to improve the oncology care pathway. What we want to do is here, as one example, is we want to be able to predict that a certain patient that has an appointment, right, for a diagnostic or therapy appointment doesn't show up. And when you can predict this, you can do something about it upfront, right? Because when a patient just do not appear, it's a big loss of money for the healthcare provider, very briefly. And then the third use case is really focusing and circling around the healthcare consumer, so the patient. Here, what we want to do is we want to bring the gathering of patient feedback, so patient engagement, patient feedback, to the 21st century. Today, it's often just paper questionnaires. And what we want to do is we want to gather this feedback via digital tools. Let me throw to you like NLP, chatbot. We want to ingest wearables data and then use this data and visualize this in front of the healthcare provider in an, let's say, actionable manner. This is in a nutshell the 3 areas we want to work.
Well, thank you for mentioning that. Patricia, would you like to have like a closing one to invite startups to Vira and G Healthcare Accelerator?
I just want to say we're really excited. We're scouting at the moment. If you think you have a solution that fits the 3 challenge track, please get in touch with us. Go on the website and apply. I just want to say the G team have been absolutely fantastic, and there's so many resources behind this program. So any company that has a solution that's relevant, please apply. You're not going to regret it. That's for sure.
Amazing. And then, so yeah, please go on calling all AI startups to go on to vira.uk and find more information. I just want to thank you so much for coming tonight and then sharing all this fantastic knowledge. I believe we at least uncovered that innovation puzzle a bit, and hopefully we will all join forces to tackle one of the most impactful industries, which is health. Thank you so much once more.
Thank you very much.
Thank you, Peter. Thank you, Jan.
Thanks.
See you
Thank you.
soon.